Thank you all for joining us today. My name is Andrea Baer. I am the program manager here at Arrhythmia Alliance, and I have the great pleasure of being joined by Rex Gale. He is a patient and a motivational speaker. And so we're going to dive right into the conversation. Before we get started, though, what I need to do is go through some housekeeping. Please stay on mute unless it is during the question and answer time and you've been asked to unmute. We are in a meeting presentation, and so if you are not muted, we will hear your conversations, and we don't want that. Please feel free to enter questions into the chat box at any time during the presentation. We will get to them at the end because there will be a question and answer period at the end of the presentations. And also please note that the presenters, myself or Rex, will not be giving any medical advice, and nothing we share should be considered medical advice. Please consult your healthcare provider for questions, and also be very cognizant of the fact that it is a public forum, so please do not share any personal medical information that you might be asking a question about. So, as we get started, we're going to talk today about empowerment. And the empowerment really is a process of becoming stronger and more confident. And especially in this conversation of being able to control your destiny and claiming your rights when it comes to healthcare decisions. Just a little bit about me. I am a mom of 4 plus 1, my son-in-law, who joined our family many years ago. I'm a grandma of 2. If you notice there on your screen, the baby is not quite old enough to be a martial artist, so she is stuck in the car seat. I am a heart mom, and I am a patient advocate. And a heart mom, what does that mean? Well, my third son made me a heart mom when he was born with congenital heart defect. He had open heart surgery at 11 weeks old. And at that point, I was thrust into this life of cardiac surgeries, cardiac diagnosis, and a world of medical mysteries that I never really asked for. And I feel like most of you on the call probably felt the same way at some point in your life. So, because nobody signs up to be a patient. Diagnosis can lead to fears, worry, feelings of inadequacy. You probably have asked yourself the question, why me? Or now what? Whether you're a patient or a caregiver, you've probably asked those questions. And to be fair, they're all very normal feelings. I feel like everybody at some point in time on this journey has asked those questions. And so we're here to help you feel really empowered to be able to make these decisions and feel a little more secure in the diagnosis that you've been given, whatever that diagnosis is. It's important for you to educate yourself and understand the diagnosis, but also the treatment options. And so you can make those decisions about treatment that are best for you. And we're going to talk about that later on. You should be becoming a part of the solution and advocate for yourself and then eventually for other people. And we encourage you to seek support and give support when the time is right. So we're going to start off with educating yourself. You need to talk to your healthcare team, but understand that it takes on average 7 times of hearing something before you retain it. I can still remember very vividly the day my son was diagnosed with a congenital heart defect. I was postpartum about 4 hours in a hospital bed, and the doctor was saying words to me that I did not understand. And my first thought was, how am I going to Google this when I don't even know how to spell it? So you have to continue to ask questions until you understand. It's really important. If you don't understand something, ask them to explain it again and ask them again until you do understand. Sometimes it's helpful if you have the chance to write questions down beforehand, because we all know how we get into the doctor's office and we're nervous and we feel like we're being rushed, and we probably are being rushed. And then you get out and you're like, oh man, I forgot to ask about whatever it was. Make sure that you, if you want, write them down, if especially if they're important. I do remember when I was with my son one day at a cardiology appointment, and I asked a question, and he says, "I see you've been Googling." And I was like, "Well, yes, I have been." But I asked those questions to him. Speaking about Googling, please do not research on Google uh, and just pick the very first thing that comes out of the Google search. It's usually something like Wikipedia, um, and that information is definitely not reputable. You want to make sure you're going to reputable sites only. A lot of hospitals and patient organizations have websites that you can get information from, and that is where we really encourage you to focus your information, um, because there is so much misinformation out there and it's really hard to filter through. And then connect with others. You know, you can learn so much by just talking to other patients. Um, Maybe not specific medical advice, but how to live and thrive with a diagnosis. That information comes from other patients. I've learned way more from other moms than I ever would have learned from a doctor about how to parent a child with a congenital heart defect. Patient organizations such as us, hospitals sometimes have their own support groups, but make sure you're reaching out and connecting with other people. And these are just some of the resources and patient information that we have, but it's an example of what you can find from patient organizations. And it's, like I said, it's really important to make sure that you are going to reliable sources to get that information. And so understand your diagnosis and your treatment options. You will want to know your immediate impact, but also the long-term impact. And then your treatment options, making sure to be weighing the pros and cons of each. And think about, as you're looking at different treatment options, what is your family work responsibilities and the impact on the quality of your life, depending upon the treatment options that you choose. And that is going to be different for everybody. You know, when you're making these treatment options, you'll see my son, who is not a baby anymore. He also has Down syndrome. And one of the problems that we had when we had to do a stress test was that, number one, he does not comprehend information like I might or like you might. And so, as we were talking about how we were going to get this stress test done, there was no way he could go through a typical cardiac stress test. And so I talked with the doctor and we made a decision on how we were going to get through this to get the information that they needed, but also to not put undue stress on him. Because to be fair, just being there is stressful enough for him. So you want to consider your lifestyle and your financial considerations, how this treatment or these tests will impact you and your family. Is it feasible? Because sometimes, to be fair, it's not feasible. If you've been given all of these options and you want to decide on the best one for you, in your situation. And if you can, this is not always an option, but if you can, take the time to discuss the options with your family. And then you can come to a decision. And that is really what we consider shared decision making. So we're improving patient outcomes because if you are on board and you've approved and you've bought into this treatment because you really believe that this is the best option for you, you're going to be able to do it, right? If somebody said to me that my son had to, at 8 years old, had to take 25 pills a day, I would say, this probably is not going to go well because he can't swallow a pill. You can follow your treatment option much better if you are doing a treatment that really works and fits in your life. So you're going to be able to improve yourself and your well-being. But you also are going to increase that self-esteem and independence and have control, right? So that you're going to be able to adapt to this lifestyle much better when you have made the decision yourself instead of just being told what to do, which is an old paternalistic type of medicine, which we have really tried to get away from because we want you as the patient or as the caregiver who's taking care of a patient to be the ones in the driver's seat. And that means that you're going to become a part of the solution. So you're going to be proactive, okay? And you're going to take this role serious because you need to be engaged in your treatment plan. You must take that lead, but be respectful in all your interactions. Being a part of the team means that you are taking that responsibility to be a part of the process and not fight the process. So be respectful with your interactions, but also remember that you have the right to change your mind. You can start a treatment or you can start down a road on a path and say, this isn't working for me. Can we look at something else? And maybe the answer is there's not something else, but you need to make sure that you're giving yourself that benefit of being able to change your mind and talk to your doctor. And this, I know everybody has all probably heard this a lot, and so we won't belabor the subject, but make sure that you're also taking care of yourself. A healthy lifestyle really can make a difference in living a healthy, fabulous life despite a diagnosis of an arrhythmia. You can make sure that you're doing the right things by exercising, by eating a healthy diet, staying hydrated, avoiding stimulants like caffeine, um, and doing that and being empowered to make good choices for yourself despite where you are in terms of treatment. And then once you're feeling really empowered and you're feeling great about being able to have control of your life and of your personal journey, then you can start really advocating for change. You can talk about what your story is and how much you want to share about it, because that's important. Some people love to share. Some people don't want to share at all, and both are fine. But you have to make those choices for yourself. And you can think about the impact of your condition in your local or your national context. And what would you like to achieve? What was your personal goal? Almost 17 years ago, when I started on this journey, my only personal goal was to never let a mom feel like I felt when my son was diagnosed. I didn't want anybody to feel alone. I didn't want anybody to feel like they were the only person dealing with this. And that was my goal, and that was good enough at that point. And it was a great goal. The goals changed and the goalposts changed, but that was it. And that I zeroed in on doing that. And then who are the key people who can help me achieve this goal? And then what messages and methods are required to reach the audience you're trying to reach? And that's the stages of advocacy. So you want to advocate for yourself first, become empowered, be the best patient, and living your best life. And then you want to empower others to advocate by sharing your story, by lifting other people up and sharing the knowledge that you've gained over the time that you've had your diagnosis. And then you want to advocate for those who have no voice. And that is where I am in my stages of advocacy. But I did start with just advocating for myself, being scared, not understanding what was happening. That was me. And I just listened to a doctor, right? Because the doctor is the one who knows the best. Um, but I think that as you grow and as you become an advocate for yourself, you're going to want to empower others. And so it's really important to share that gift of knowledge to other people. And these are some ways that you can advocate. You can support others. You can raise awareness and share on social media. You can share your expertise as a patient on hospital patient advisory councils, industry patient advisory councils. You can do surveys for organizations and industry. You can volunteer. You can engage with any of your representatives, write letters, make phone calls. It's an endless possibility of ways that you can get involved and give back. And giving back is really important. And one of the funny things about giving back is, and actually, when you are volunteering, it really scientifically improves your well-being. It's scientific fact, not just making that up. So get involved and give back and support others. And some of the ways you can do that is through Arrhythmia Alliance or other patient organizations. If you're involved with them, you can connect with others and share your experiences, and you can get and give support. And I always like to say get and give, because I feel like that is something that fluctuates depending upon where you are. And sometimes that changes. Sometimes you're giving support and you're doing great, and something happens and then you need support. But now you have that support system that you can rely on because you've involved yourself within that system. And patients who feel supported are more likely to adhere to treatment plans. And that is the ultimate goal. We can help you here at Arrhythmia Alliance by offering a listening ear. We have a patient services team that is amazing, and they have lots of information about different conditions, how to support you. They can give you advice and they can give you information. And we have online coffee mornings every month. You can join us, you can meet the team, you can get involved. They are great there in patient services. If you were interested in sharing your story, you can do that. We have stories from the heart. We love to get stories from patients because, to be very honest and open, your story could be a life-changing difference in somebody else's life. I can remember searching the internet looking for somebody whose child had the same condition as my son because I needed that reassurance that we were going to be okay. Now, obviously, everybody's story is different, but if you're in that situation, those little straws that you're trying to grasp for is really important. And your story might just be that person's story that encourages them that they can do this and that it's okay. And so before I turn this over to Rex, who is definitely the story you probably want to hear, I just wanted to make sure that you knew that you could become a volunteer with us to raise awareness of arrhythmias by sharing your story. You can promote awareness where you are in having a local event, or you can do it on social media. We're all on social media, and this is World Heart Rhythm Week. And so if you want to go out and share some messages, feel free to share our messages. And then just know that we appreciate you and we appreciate your time. Volunteers make a huge difference in our vital work, and the volunteers are always the ones who are out in the field doing all of the hard work. So we appreciate you, and your support is also so appreciated. But now I'm going to turn it over to Rex.
I think I'd like to just sort of share a little bit about, from a patient advocate's perspective, you share your stories so people can understand sort of what they might be going through and what they might continue to go through over the next 15, 20, 30 years. The first thing I want to do is speaking about health and caffeine, just have a bit of my coffee here. Because the first thing I want to share is I was a little bit unusual when I was not diagnosed with atrial fibrillation. So I was 40 years old and I knew that there was something going on. And that's how this happens for most of us. We take our pulse, and we know that I was one of those people that when I go to sleep at night, I can actually hear my heartbeat. I literally can hear it. And so I knew that there was some kind of an arrhythmia going on. And I would go to the doctor and they would do an EKG and they would say, well, you're 40, you're really not that old. There's probably nothing wrong with you. And I would go back and same thing because it was intermittent. One of the toughest things about being diagnosed with a heart arrhythmia is they are so intermittent and they tend to be so infrequent. And although we are getting better with monitoring technologies and heart monitors and halters that are very, very small these days, the toughest thing is knowing that you have some kind of a condition, but not being diagnosed for that condition. And this went on for me for almost 10 years. And in the meantime, I knew a lot more about this condition and a lot more about the medical system because in my profession, I was actually a healthcare consultant. So here I am knowing a lot about health, knowing a lot about wellness, knowing a lot about nutrition. I wasn't overweight. I was very fit. And once my wife called some friends and said, "Hey, Rex is in the hospital. He's got atrial fibrillation. He's got this heart issue." They're like, "Rex, what?" So my first message is this can happen to anybody. And the thing about heart issues and heart arrhythmias is, and I don't want to start on a downer, but the number one condition of a heart arrhythmia or of a heart issue is sudden death. So, we really need to understand that, the heart is something that we really need to sort of stay focused on. And I just want to share a little bit about what happened with me, because even though I went to the doctor a number of times, was not diagnosed, 10 years later, I finally did go to the doctor. I knew that I had this arrhythmia happening. And so they hooked me up to an EKG, and the doctor said, "Yes, you're in atrial fibrillation, you're an AFib. We need to get you in to see a cardiologist." But it was 3:45 in the afternoon, and I couldn't get in to see a cardiologist until the next morning. Sure enough, that night, like many people, I got up to go to the bathroom. And then as I'm coming back to bed, I had an episode of syncope, meaning I fainted. I fainted coming back to bed. And this has probably happened to all of you that are on this call. Sometimes it's just getting up too quickly out of a chair and you get that little bit of a dizzy sensation. Sometimes we don't always sort of pass out. And I fell and I hit my head on the bottom of the bedpost. And I get back into bed and my wife's like, "Are you okay?" I'm like, yeah, I'm fine. And then I was sort of touching the back of my head and I said, I think I might be bleeding. So to make a long story short, my wife takes me to the hospital. Now, remember, I had been diagnosed with atrial fibrillation earlier that day. When they admitted me into the hospital, they admitted me for syncope, which again is an issue that can be caused by heart arrhythmias. It can be caused by a number of things. It can be caused by stress. So even going into the hospital after having been to see a doctor, and again, I don't know if it was one of those, I wasn't really talking that much. Uh, the first thing you really need to do is understand really what is going on here. And once I became aware of what was going on, again, it was sort of unusual. I worked in the healthcare industry for a healthcare consulting company. We had a medical officer in our company who I literally called to say, "Hey, I'm in the hospital. I'm having these kind of symptoms going on. What can you tell me?" He's like, "Well, I'm not there. I'm not seeing you." So even the best situated people at some point are going to be put in a situation where you have to rely on the expertise of the people that are there and treating you. And in my specific situation, I said, "Well, you have a relatively low heart rate to begin with. The medications that we typically give for atrial fibrillation tend to lower your heart rate. We're afraid that you're going to have more syncope events. And so you need a pacemaker." I'm like, "Whoa, whoa, 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 whoa. This is all within like 3 hours of being in the hospital." But again, you have to rely on your healthcare professionals. So 6 hours after I was admitted, I was implanted with a pacemaker, and which was fine. Now I have this inserted medical device, um, but at this point, I'm like, okay, well, what do I need to figure out what I'm doing here? And partly because of my background, I said, well, this was an emergency situation. They put me on a specific kind of medication. I was discharged from the hospital, and I went to get a second opinion. And I think this is the first thing, sometimes we rely on the healthcare system to treat us, but there have been so many numerous studies that say even where you live in a community affects the treatment that you're going to be given. If you live in California, if you live in Florida, if you live in Maine, a specific condition is going to cause most of the providers in that area to treat you in a specific way. And that can differ. So again, I did get a second opinion. And in fact, I got a third opinion. So I went to see three different professionals, and that's where I learned that there is more than there's more. There's not just a cardiologist. There's something called an electrophysiologist. I did not know that at the time. But again, asking questions and doing research, I went to doctor number two. Doctor number two wanted to change my medications. He thought I should be on something different. Doctor number three, who was, again, he was a cardiologist, I finally ended up getting referred to somebody who was an electrophysiologist. And he was the one that I ended up going with, not necessarily because he was an electrophysiologist, but that was a big part of it. Electrophysiologists deal with the circuitry in your heart, and not with the plumbing. So he starts to take over my care. Again, I was on, because I had atrial fibrillation, there is a risk of stroke, which is one of the biggest things I think that heart arrhythmia patients deal with. What about stroke? Am I going to die? What, all of the emotional things that you sort of start going through, and it becomes really an issue because you're dealing with this not only physically but also emotionally, and trying to bring your family into what was going on. So here I am. I finally have my provider. Um, they did cardiovert me back into sinus rhythm. So on the table, shock your heart, back into sinus rhythm. I'm on an anticoagulant. I have concerns about that, but at the end of the day, my emergency is past. So now you're past the emergency and you're trying to, okay, what do I deal with sort of moving forward here? I know I've got this condition, sort of how do I treat it? Now also I've got this pacemaker. Well, the electrophysiologist said, you probably didn't need a pacemaker. I'm like, well, thanks for that. But he said, however, you have a pacemaker, which is measuring every beat of your heart. And the bottom line is it does not limit your ability to do anything you want at all. And so in a way, I've almost been happy that I have had this implanted device, because as I have gone through my treatment, and I'll continue with that in a minute, they literally have been tracking every beat of my heart for the last 20 years. I finally was diagnosed. This was when I was 50 years old. And I remember going into the, uh, the electrophysiologist office, and I saw all of these old people, and they were looking at me saying, "What are you doing here? You have a heart issue? What's going on?" Because I looked so much younger than the typical patient that was there. And that was another emotional thing for sort of me to deal with. It's like, hey, I've got to now deal with this for, for a long time. So, I finally get on medication. I'm on medication. My arrhythmia is being controlled. I was able to eventually get off of my anticoagulants, which again was really helpful for me psychologically, because again, I think the biggest thing about any arrhythmia patient is the risk of stroke. Just the way that there can be some issues with your heart where blood can get collected, can cause some kind of a stroke. So things are going along fine. I am still having episodes. I learned from experience. I learned that some things that I was doing, getting back to lifestyle, if I would drink a little bit too much, sometimes it would kick off some episodes of AFib. Sometimes if I would eat too much, it would kick off episodes of AFib. So you become very attuned to what your body is telling you, and it's totally erratic. You really don't know what's happening. So I am on basically on a medication for about 10 years. And then I started having more and more and more events. And my doctor said, well, if you continue to have these kind of events, then we may have to put you on another anticoagulant. But there is another procedure as we go through this process. You're diagnosed, you cardioverted to get back into rhythm. We use medications to keep your heart in rhythm. If the medications at some point in the future don't work, there's a procedure called an ablation. The ablation is where they literally go in and they map the electrical currents that are flowing through your heart that are causing those electrical pulses that are putting you into AFib. And they literally will go in and they will basically zap them. Okay, here's where this path is interrupting the circuit. Let's cut it off. Let's cut off this path. So they map it, they go in, and they basically cut all those off. That's the ablation. I had a cryo ablation, which is it's basically a cold ablation. The only danger is it can affect your esophagus to some extent because it's so close to the esophagus. But the bottom line, I had an ablation a few years ago, and after that point, I literally have not been in AFib for about 3 years. So I have gone through over the last 20 years the full treatment of knowing something was wrong, but not being diagnosed, finally being diagnosed, going through the pattern of being cardioverted, being put on medications, going through the healthcare system, understanding the difference between different kind of providers, cardiologists, electrophysiologists. I've learned a lot through that process. I've learned that the medication at some point might not work. They can try to put you on another medication. There are plenty of studies and surveys out there, and during this process was when I got involved. I was actually living in Hilton Head at the time. And that's when I met Trudy and the folks at the Arrhythmia Alliance. And I had the good fortune to serve on the board of directors at the Arrhythmia Alliance for a number of years. And the other thing that I'll sort of say is you need a resource, right? You can go to the internet and the internet will tell you, you can ask it a question and you'll get 172 different answers to that question. And so you want something that is well researched. And I find that having one source that is integrating information from all other places all over the world, and Arrhythmia Alliance and Heart Rhythm has been just such a great resource for me in dealing with these things over time. The other thing I found is that getting back to being a patient advocate, I have been involved. I've had the pleasure, because my background was healthcare, I've been involved on a number of different studies. One of the, a number of them around atrial fibrillation treatments, and those kinds of things. And I've also had the fortune to attend some of these, world and local congresses to give the patient's perspective. What I have found is in most of the sessions where I participated, I was the only I was the only patient advocate. There is so much focus on the technologies, new treatments. The physicians get together, the doctors get together, the medical device companies get together, and they talk about all of the improvements, but they really don't talk about the patients. And I've been blessed to have been able to contribute somewhat to that discussion over time. And I think that's one of the things I would like to really encourage you as well. Um, even ask your physicians. So where do you get your ongoing training related to arrhythmia treatments? Oh, we go to these events, and well, do you have patient advocates that are there as well? Because what they don't really understand is the patient mindset. And I guess I want to sort of end my part of this with talking about that. So there's so much uncertain when you're diagnosed. There's so much uncertainty about what the future is going to hold. Choosing the right physician, multiple treatment options. I went to three physicians. I got three different courses of treatment, and so sort of what do I do? The treatment concerns around anticoagulants and the fears related to that. Stroke and internal bleeding, quality of life fears, all of those kinds of things. So I've sort of shared my story, but I have three takeaways that I've learned that I really would sort of suggest that you sort of take to heart. One is you can be your own advocate, but someone else, like Andrea was saying, she was her child's best advocate. Often people don't really want to help themselves, or they do want to help themselves, but when something goes wrong with someone else in the family, they are typically the best advocate for you. So have a family member, have a friend, but have an advocate, have someone close to you that will join you on this journey. When I was in the hospital, they told me lots of different things about my treatment. Uh, and I didn't have the ability to really understand what that was. Today, anytime I go to the hospital, anytime I go to a doctor, anytime my wife goes to a doctor, we go together because 4 ears are better than two. And particularly as you go through this journey, it's really, really important. The other thing I've learned over time, and again, consulting around healthcare, is always get a second or a third opinion. You have one heart, and you are doing your due diligence in making sure that you understand what your condition is. And again, I say this only because of my background and because of my experience when I had this issue come up. I went to three different providers, and they gave me three different treatment protocols, three different approaches to how I should be treated, three different approaches to what medications I should take. And that's okay. They all have their different approaches, but it's up to you to talk to a number of different providers, and then you can make the decision. This seems like it's the best course of treatment for me, and access all of the healthcare resources that you have out there. And the last is keep informed and be an advocate. So heartrhythmalliance.org, that is sort of it's the one place I have gone. It's the one place I go. They will direct you to many, many other resources. But if you need help, if you need assistance, do that. And remember, this is probably the most important thing I will say. This picture of me ziplining was not 30, 20 years ago. It was a couple months ago. And even though you have a heart condition like AFib or any other kind of an arrhythmia, do not let anyone steal your joy. Uh, my doctors always said, yes, you have this condition. You need to manage this condition. You need to treat this condition. But in my specific case, you can do anything you want to do. You want to go snow skiing, water skiing, zip lining, skydiving, do that. Understand that your body has something going on with it, but with the right course of treatment, with the right providers, with the support that you need, and uh, you can do anything you want in this life with your condition. So do not let anyone steal your joy, and enjoy life. And if there's anything else I can impart, happy to answer any questions for you. But I appreciate your time and effort, and hopefully I shared some things that might be helpful as you go down this path as well.
Thank you so much, Rex. What a great presentation and story. My only question is, how did you get your glasses to not be falling off of your head while you're upside down?
I guess they're too tight.
I guess. That's
I have
amazing.
headaches. Yeah.
So we are at the question and answer period now. So if anybody would like to ask a question, you can enter it into the chat. And if you want to speak and talk, please raise your hand and we will call on you and you can unmute and ask the questions. I am going to give everybody just a second to see if anybody has a question. I don't see any questions yet. That's either we did a really good job, Rex, or we didn't. One or the other, because there are no questions. Seriously, as you're thinking about your questions, just know you can become a patient advocate. We provide free training online. Um, it's at your own pace that you can do it. It takes about an hour to do fully if you did it start to finish. Um, we also provide opportunities to support others. We can give you opportunities to get involved and be a patient advocate, and lots of resources to learn and share with others. So you can reach out to me at a.baer@heartrhythmalliance.org. You can scan the QR code that's on the screen. Um, and you can also browse all of our free patient resources. So the first question, Rex, is for you. What happened to your pacemaker? Did you know it can be donated if it's explanted? That's a great question.
I'm on my second pacemaker. Pacemakers have extended battery lives. My first one lasted about 12 years. Um, Actually, I don't know what happened with that. It's a good question. Um, the technology again has improved significantly. Another problem with my first pacemaker is it was not MRI compatible. So this is another question, another thing that patients deal with is if I had some other issue within my body that needed an MRI, um, I could only get a CT or an X-ray because of the device in my body would not allow me to actually get any kind of an MRI. So that was an issue at the time.
Yeah.
The pacemaker that I have now is MRI compatible. So now, if I do have another issue that needs to be dealt with using an MRI, I do have the availability of sort of having that done. So that is a good thing. So again, the technology continues to improve, significantly. Um, the
Right.
other question is about three different doctors, three different opinions, and um, what the different recommendations. How do you weigh those factors when choosing a treatment path? I think one of the big things, I did have an electrical issue. So it was heavily weighted, I think, toward finding an electrophysiologist. Um, I did ask some people who I trusted for references. Um, and again, you can use resources like if you have a healthcare system, Blue Cross Blue Shield, whoever it might happen to be. They have resources, they have nurse lines, they have ratings on their systems that will give you. You can search for electrophysiologists in an area. That was one of the big things. Also, he talked to me about medications too, and things I never knew about. Okay, so okay, you take a metoprolol or whatever the specific medication might be, but there are calcium channel blockers. There are very different kinds of medications that go after treating a condition in very different ways. He he did not have he didn't say you need to do this. The other two doctors said, yes, you should be taking these medications. The second one said, I want to take you off of what you're taking now and put you on this one. My third doctor, who's the electrophysiologist, he said, well, there are advantages to each of them, and let's look at what those are. And he said, actually, there's a third option, which is a calcium channel blocker, which I have seen success with patients in your age bracket that have early onset, but they are sort of early that are younger in the overall process. So it was just listening to what they were all saying and deciding, making my own decision on who I felt most comfortable with. Um, I hope that answers your question.
Yeah, and I think also just to add how the second half of that question was how should patients weigh those factors when choosing a treatment path? I think going back to the conversation about what works for you, because you have to make sure that it will fit into your lifestyle, will fit into what you can achieve and afford personally within your life. Um, while you're weighing the pros and the cons. So if they're all equal, let's say, in the treatment of the diagnosis, then which one will fit into the lifestyle the best? For example, as a child, when my son would need antibiotics, we always chose the shot versus the antibiotic. Because if you've ever restrained an alligator to give them amoxicillin 3 times a day, that is what we would have dealt with versus a one shot, it's painful, yes, but it's done, it's over, we can go home. And we don't have to traumatize any longer. Same treatment outcome, easier for us to deal with. When in reality, maybe a different family would just rather take the antibiotic 3 times a day and not manage the shot. So I think personal choice is really important when you're choosing that treatment path. If it's possible, all factors being equal, you need to rely heavily on yourself and what fits into your life the best. Okay, let me see. This is a great question. So, when I went to the ER with a rapid heartbeat and feeling dizzy, the intake person first question was asking if I had anxiety and could be that before they even ran any tests. How can this bias be addressed? That's a fabulous question. And we see so often, especially with females, that the very first thing a doctor will tell you is it's anxiety. It's stress. You need to lower your stress. It's anxiety. Um, Rex, do you have suggestions on how to manage that? Because I think that that's a really important question.
Well, and again, going back to my specific situation, I think when I went into the hospital, they diagnosed me with syncope. So, and again, typically syncope is caused by stress, anxiety, and not what I was actually experiencing at the time, which was atrial fibrillation. I think the question's a good one. They do jump to conclusions, and I think the answer is always um, no or yes, whatever it might happen to be. Yes, but I've got this issue that's going on. I don't know what it's related to. Um, you know, I hate to say that's why I'm here, but I've got this. I've got this issue. I've got a rapid heartbeat. I am feeling dizzy. I don't know what's causing it, and this gets back to this could be they could be going down just sort of their treatment protocol. These are the first kind of questions we ask. Hopefully they ask some additional questions beyond that, and even if you were going through something, even if it is anxiety or stress that's causing that issue, that is an issue that needs to be treated. So yeah, it's unfortunate that those kind of things happen, but again, just being your own advocate and having that other person with you that can help you be, their own advocate as well. Um, there are just so many cases of having that extra person with you that can almost be it's almost like a triage between you and then the doctor or the nurse or whoever's treating you, to say, well, maybe there is anxiety or not, but at the end of the day, I've still got this going on. How can you help?
Yeah, and I think it's really important to acknowledge that maybe it is, but I really feel like it's important that we investigate further. And I'd really appreciate it if you would order this test or that test, or, at least um, make sure that we rule out anything other than anxiety or stress. Although they tell you to reduce your stress, and then you're like, okay, well, if it was that easy, then I probably wouldn't have to be here anyways. And so making sure to acknowledge, but also be your best advocate and stand up for what you really think is important. So the next question, Rex, the patient has a rare condition, which means they're in permanent AF and they have an ICD and a pacemaker. But because of the genetic cardiomyopathy, the EP that the patient is seeing says an ablation is unlikely to work. So they're finding that not many doctors understand the condition. Um, they think, the doctor knows best and will consult their EP, but nothing is happening in that movement. um, I'll provide my input, and then I'll let Rex. I think that it's really important for you to research in your local area for a doctor who may specialize in the specific type of genetic cardiomyopathy that you have. And maybe they have more experience with different treatment options. And I would see if you could get a second or third opinion from them. What do you think, Rex?
Yeah, I think the same thing. In again, both my work experience in healthcare, things related to centers of excellence and things like that. I'm a big believer in large teaching hospital. So I don't know where you are. When I was living in Dallas at the time, and one of the best large teaching hospitals was Baylor. That's where I ended up going, and that's where I ended up going to get my third opinion. Um, I do think getting a second or third opinion, and they may be right. The electrophysiologist may be right. Maybe the ablation is not going to be working for you, but I would definitely, number one, depending on where you are, if there is a local large teaching hospital, or if there is not a local large teaching hospital, I would even try to find the closest to you and see if you can schedule a second opinion. This gets back to being your own advocate. Often having a specific issue is something that you really sort of need to deal with. But again, I see you're going back. My local hospital
Yep.
is where I get taken in an emergency. Um, yeah, when you get taken someplace in emergency, that's another huge issue. I was taken to a local hospital when I had my specific condition, and within 24 hours, I had made the determination, and it's. I was told when I was admitted, and I wanted to go to a large teaching hospital, that they would call an ambulance, but they would take no responsibility for me once I left their hospital, which was tremendous pressure on me to do nothing. And it wasn't until the next day that I said, well, I feel like I'm stable enough to sort of do that. So, healthcare is so specific and it's so local. Um, but when that's an issue that you really can't get around unless there is another provider, or you have some kind of a health line or helpline through your either insurance provider, through your EP, wherever he might happen to be. Just make sure you're communicating with them as quick as possible. I mean, that's a problem with the healthcare system, right? Every hospital wants to provide the best care, but they can't. um, that's why you have centers of excellence. Every hospital wants to be profitable. There are more hospitals probably than there should be, um, but that's a system that we have to deal with. So um, I would like to talk to your provider about that.
Yeah, I would talk directly to the EP. And if
She's
you would
asked.
like to email us directly, email me directly. I can provide some more information or we can get you some more support. I don't want to get too granular and too in the weeds about a specific case, only because we might not be understanding and directing specifically to you. But we are at time, Rex. That hour flew by. Um, and so, yeah, and so Linda, you're in the UK. You can call our patient services team if you'd like to call directly, um, and or you can email directly. I know we have our US information up here. I will send you our link to the patient services line directly. Maybe maybe Jessica or Kelly could send that, or Jessica, could you send that in chat to her? Thank you. And then you can call directly into the UK because I'm in the US. I mean, I can still call you, but it would be much better if you spoke to our lovely patient services team in the UK because they will be able to give you better information. But thank you everybody for joining us. We really appreciate your time. Please reach out if you have any questions or you want to get involved or get in touch. We're happy to be here for you anytime. So I am going to stop recording and I'm going to say thank you very much for joining us today. We appreciate you.